guys, you're welcome to today's shows on Let's Talk Health. Today we'll be talking about a very interesting topic which is very key to women, menstrual cramps or menstrual pains. Some people believe that when you have menstrual pains and you give birth, the pains subside. Some also believe that when you bath in the same washroom with somebody who is having the pain, you also get the same pain. Whether true or not, today we'll be digesting that. And I have with me Pius, attorney.
You still want to mention it anyway. Thank you
You're
so much.
You're welcome, Pius.
Yeah, thank you. You know, that's not only myth I've heard about it. I have also heard that menstrual cramps are when a woman with that wee-wees and then you pass through, you tend to contract it. Whether it's contagious or not, I can't tell. That's the issue. Anyway, so over to you.
Oh, I'm Emefa. How have you been? How's your week?
I'm good. The week has been great.
Okay.
Yeah.
Okay, guys. So to digest this today, we have with us a medical doctor, Dr. Victor Loglo. You're welcome.
Thank you.
Doc, how have you been?
I've been good. I've been okay. Thank you for asking.
How
have you been also?
Oh, I'm good, by the grace of God.
Right.
Yeah. So today we'd like to know what menstrual cramps is, what causes it. Like, who wants to know? Can you tell us something about it?
Okay. Thank you for the question. Menstrual cramp is an important topic. Menstrual cramp has, it can be graded as part of the top 3 reasons why women attend to a doctor in a clinic.
Okay.
The last time we said...
So which number is he playing?
It depends, okay? It depends on what is happening around the time. So,
no problem.
But in the top 5, we said abnormal discharge is one of them.
Okay.
In fact, abnormal discharge is part of the top 3. It's part of the top 3.
Mm-hmm.
Okay. And the next thing after that is menstrual cramp. Menstrual cramp, even though it is not life-threatening, it can be very, very exhausting and debilitating. It can be physically taxing. It can even affect both the psychological and the behavioral patterns of the women who suffer it. Okay. Research has shown that it's associated with absenteeism, both at workplace and then in school among adolescents. Okay, so one of the reasons why some women may not appear at work, and this can affect productivity.
Okay,
if this is caused by menstrual cramp, then you realize why it is an important topic to talk about.
Okay,
you get it. So when we say menstrual cramps, it's just like as the name goes, having cramps during menses, having a painful menses or a difficult menstrual flow. It's as simple as that. It is very important to understand that it is not all menstrual cramps that is all about giving a pain medication. It is an important point to note.
Okay.
Because it depends on the cause. Okay, so in managing it, you have to know what type of menstrual cramps you are dealing with.
Okay.
So we have 2 broad categories of menstrual pains or menstrual cramps. Mm-hmm. We have the primary menstrual pains, and we have the secondary menstrual pains.
No tertiary.
No tertiary. Okay. For the benefit of our discussion, because I know we have all kind of people watching us, I may be interusing the words menstrual pains, menstrual cramps, and sometimes the medical word, which is dysmenorrhea. So let's get used to it.
So all 3 words are the same.
Yes, I may be using. They mean the same. So if you hear dysmenorrhea, menorrhea means menses. Okay, this means a painful. So painful menses. Dysmenorrhea.
So when you say discharge, painful charge. Anyway, don't mind. Let's box on.
No, that one is not with the Y.
Okay.
That one is I. You see that?
Okay.
Yeah,
Okay.
but this is the one with the Y.
Okay.
Yes. So dysmenorrhea, menstrual pain or menstrual cramp.
Okay.
Now, remember I said how many broad types do we have?
I said 2.
Super. Great.
Okay.
So the first one is a primary dysmenorrhea, and the second one is a secondary dysmenorrhea, obviously. Once one is primary, the other one is going to be secondary.
Okay.
Now, the primary dysmenorrhea, we say someone has primary dysmenorrhea at the time when this menstrual cramps is not associated to any pelvic infection or pelvic disease.
Okay.
Okay? So, but however, it has a cause. But it is not due to any anatomic or microscopic problem happening down there.
Okay.
It may be just a physiological thing, a normal thing that is going on.
Thing natural.
Natural. So the question will be, what is the normal thing that we are talking about that happens?
Okay.
Now, before I talk about this, just note that this kind of dysmenorrhea is common in post-pubertal age.
Okay.
Post-pubertal, yes. So we're talking about from 12 to 17, 18.
Okay.
You know, it happens in the early years after menarche or after the first menstrual flow.
So the first menstrual flow is called menarche.
Yes. That's the medical term for
menarche.
Yes,
Menarche.
menarche.
Yo, Charlie students, write it down. Okay.
Well, I will give you an assignment.
Okay. We are
If the
waiting.
first menstrual flow is menarche, I would like you to find out the first semen flow or spermatic flow.
So because I asked.
No, it's for the viewers to type it in the comment section.
Okay, that's great.
Yes.
No.
So viewers, you have heard it all.
Yes.
Just get to the comment section
Yes.
and
The
put
first
it there.
time.
The
Don't
first
tell me
time.
wet dreams.
Okay.
No, it's not wet dreams. Okay. Yeah.
Sperm or semen?
Yeah. The first time a man sees an ejaculate.
I've actually not thought of
An
it.
ejaculate of a semen.
I've never thought of
Yeah,
that.
there's a term for that. If we have one for menarche, for menstrual flow, there is one also for when the first semen
Okay.
comes out.
Okay, doc.
Yeah. So that's for the viewers to give it to us in the comment section.
Sure.
Now, so I said it happens in the early years after menarche, after the first menstrual flow.
Okay.
And out of every 10 young girls, adolescent girls, about 5 are going through this.
5.
About 5
So
are going through this.
just half of the population that we see walking on the streets,
Yeah.
they all go through that.
Maybe going through that.
Maybe.
Okay, maybe going through that.
Okay,
So
well noted.
that's the beautiful thing about medicine. There is not like an absolute, so we use the word maybe. I met a lady yesterday. She had not experienced menstrual cramps ever in her life. Ever. She has no idea what people talk about when they say menstrual
Then you
cramps.
wonder why some people, you see them crying.
Exactly. So that
rolling
is
on the
why
floor.
I first made that assertion that it's not all menstrual pain that you need to give pain medication. Sometimes it is more than what you are seeing. In fact, for the primary one, without even giving a pain medication, it can go on its own.
Okay.
She may be falling in that category.
Okay.
Now, this is what happens in the body. What
Okay.
happens is that, remember we made mention of the hormone estrogen and progesterone and its roles in the menstrual cycle.
Sure.
These are responsible for regulating the release of the egg.
Eggs.
Okay.
Yes.
This same progesterone is responsible for preparing the endometrial lining. Okay,
Yes,
that is
preparing
the
to receive a baby.
yeah, that's the inner layer of the uterus.
Uterus.
Okay, the uterus. It's important to note that the uterus has 3 layers. Okay, the inner one, a middle one, and an outer one. The middle one is more like the real muscles. It's like the muscle that contracts.
It's muscle.
Yes, it's a muscle. But the one in the inner is like a thin sheet, a thin layer. It has blood vessels in it. It has glands in it. This, when it becomes well formed, when the blood vessels and the gland are well formed, it is in order to prepare for attachment of a fetus.
Okay.
Fertilized egg.
So a fertilized egg. Okay. However, should there be no fertilization, it has to come out
That is what comes out as the
as the
blood.
menses. Exactly. So when progesterone drops, by the end of the whole release, when the progesterone drops, that means that the game is over, so it must come out. But as part of the drop of the progesterone, prostaglandin, a new chemical called prostaglandin, is now released. Now, this prostaglandin is a muscle stimulant, the uterine muscle stimulant, the middle layer. It stimulates it.
Okay.
So it will cause it to contract. However, if you have too much of the progesterone, it means that the contraction will be prolonged and stronger than normal.
Okay.
So it is this prolonged contraction, a stronger contraction, and frequent contraction that causes the pain.
You say if you have more of which of them?
The prostaglandin.
Prostaglandin. When you have more of it, that is what will cause the
contraction to be more stronger and frequent.
More stronger and frequent.
Yes. It also causes the blood vessels in it to constrict. So try pressing the distal part of your thumb for some time. When you do that for like 5-10 minutes, you see that it will become cold. It will become numbed. To some extent, it becomes painful. That's what happens if you press on a vessel for so long.
Okay.
It means that the cells or the tissue around the place will be denied of oxygen at a point in time. So it's going to die off, like kind of, mild death until it receives another oxygen. And that will manifest in the form of pain. So that pain from the constriction of the blood vessel and then the contraction of the muscle is what manifests in the form of the pain.
Okay.
So this tells you that should I get a medication that can cut off the prostaglandin, the pain will come down. Is that not so?
Yes.
So that's what happened. So one way to know whether what you are going through is primary or secondary is to give the person a pain medication which acts against prostaglandin.
But the pain medication is only relieving the pain, but not the contraction of the muscle. If I'm getting you right.
Exactly. So what happens is that it reduces the severity. However, the physiological process of losing the shedding off of the endometrial lining will go ahead. It will continue.
Okay.
But it will relieve you of the pain.
Okay.
You get it? Because we've all said this pain, because of its socio-psychological result. You see, when it's happening, you see some of them can affect them psychologically, behaviorally. They become anxious, some become depressed, some behave, they roll on the ground, small thing, they get angry. These are things that you don't want to happen at your workplace as a CEO or in your house as a father or as a mother. Or so this is what we are trying to.
You left one out as a boyfriend.
As a boyfriend,
as a husband.
You know. So these are the reason why medications like pain medications are there to help resolve this. So there are certain risk factors to why somebody with just a primary dysmenorrhea, it may become severe. Even though it's not secondary, it's just primary, it may become severe. Number one, ladies who had menses very early in their life, earlier than 12 years.
Wow.
They are at the risk of having a more severe menstrual pain, even though it is a primary one. It has nothing to do with some anatomical issue going on. It's just prostaglandin, but it may be very, very, very painful. Ladies who have prolonged menstrual flow. So we expect the flow to be between 3 to 5 days.
Okay.
If the maximum 7 days. But some women can have more than 7 days. The longer it takes, the more your exposure to the prostaglandin. It's just
okay.
It makes sense, isn't it?
It does.
So that is it.
So, Doc, does that mean that those ladies that doesn't experience any pain at all, they don't have the prostaglandin level being high or what?
Yeah, exactly. That explains it. Even though there are other explanations to other chemicals that are released, but the most suspect in this situation is the prostaglandin.
Because I know people who even wake up to the whole thing all over their bed without them knowing, feeling anything.
Exactly. So that is
what thing over their bed?
I mean the blood.
The blood all over them.
Please, I don't have flu. So when you are mentioning, be clear with it. So that I can
no, there are some people who doesn't experience. They come to work and then by the time you realize the thing is all the blood is all over their back and they don't even know.
So it tells you that to some extent the pain is important, right? It helps.
Yeah.
Okay. It gives you at least an information that
it becomes your bell girl. I'm about coming.
Knocking.
Get ready. Yeah. Okay. So I was giving the risk factors. You know, one of them also is nulliparity. Women who do not have a child. That is why people will say that the moment you have a child, the pain will come down.
Wait.
But remember, what I'm talking about is a risk factor, not cause.
Risk factor.
Risk is different from cause.
Exactly so.
Risk means that it increases your chances of having it. It doesn't mean that it causes it. Okay. You get it? So it's not constant that once you have a child, then it's going to end. There are people who have had 5, 10, and they are still going through it. You get it?
So, in other words, are you saying that the primary does not end until menopause?
Yes, exactly. It doesn't end until menopause.
Whoa.
Yes.
I thought it's just in young people.
No, but the secondary is more common in older people. Okay. The secondary is more common from 30 years to 45.
The secondary
is more, and we'll come and talk about that.
Yes.
Let me add 2 of the risk factors and we go to the secondary.
Okay.
So, some research, it's not a lot. Some research have made mention of obesity as one. Obesity, alcohol, and then smoking.
Once you mention obesity, you are going to tell me exercise at the management level.
Exactly. So get ready for that.
Okay, that's great.
Okay. So research has shown that obese women have the risk of having much more painful menses, compared to non-obese.
Compared to slim things.
I don't want to, So let's move to the secondary, can we?
You said 2. You mentioned just 1.
I did even 3. So I mentioned obesity, smoking, and alcohol.
As for the smoking and alcohol, we've heard severally that.
Yeah, but the smoking one is well confirmed research.
Okay.
That women who smoke a lot, just that it's not, smoking is not even a common thing in our culture here. So that's why I didn't really put so much energy into it. But yes, we have international viewers, so
that's great.
It's worth noting.
But a quick one, when you hit the gym, because you spoke about muscle, that's why I'm saying this. It gets to a time your body gets used to it, and then that weight will not have any much effect on you again.
Yes.
So you've been having the flow from childhood, then you're growing. The muscles have been contracting and releasing. When they get used to it around the age of, let's say, 25 thereabouts, so your system gets, used to the pain and you don't feel it again.
Women will tell you that, unfortunately, in fact, you cannot even compare the pain of the last one to, you cannot even predict how painful the next one is going to be. The reason is that this progesterone and estrogen release, it's what's important, noting that the release of prostaglandin only comes in immediately the progesterone drops. The progesterone job was to prepare the endometrial lining. Immediately it drops, prostaglandin is released.
Okay.
But, so it tells the amount of the prostaglandin that should come out.
Okay.
But these two, the estrogen and progesterone, is in response to our emotions and certain things that are happening around us.
Okay.
So if you are going through anxiety, you are going through depression, if you have gained sudden weight and sometimes sudden weight loss, some of these things can affect even the menstrual cycle in itself.
Okay.
So that is why no 2 cycle pain can be the same.
Okay.
You get it?
Okay.
You may have found ways to deal with the pain in terms of your coping mechanism. But when it comes to how the pain severity is going to be, you cannot determine.
Okay.
There can be a time it will be lesser than before. And this, I would say, is in relation to the hormone release at the time.
Okay. One last question before you move on. So, can food, what we take in, also be a causative agent of that? Can our food take in? You've mentioned alcohol already.
Yeah.
It's entering the system. Is there any food that will also cause that?
So that's a good question. Research has not, we don't have enough research connecting a specific food. Even though I have seen before this, I read an article on caffeine, sugary food.
Exactly. That's what I'm asking the question.
Sugary food and caffeine being related to menstrual pains. So it increases the risk of it. I read an article on that, but it's not like a developed research in terms of having more to confirm it.
Okay.
But it's still important to note that women who are exposed to more of caffeine and then sugary foods, yes, exactly.
They know themselves.
They know themselves.
Let's just zoom to second.
So that's an important one. It's very, very good. So the secondary
Yes.
causes, right?
Yes.
Because once we talk about these two, it is easy to flow into the management.
Okay.
Great. So the secondary one, if you understood the primary one well, this will be very easy, except that maybe the details. But if you remember, I said the primary one, they have no anatomic, any like cause at the pelvic region.
Okay.
They are just because of a physiological something. That is a prostaglandin release.
Yes.
Okay. Now, the secondary one, as you may expect, there is a cause. There is a pelvic condition that is going on.
Okay.
So that is the reason why if you are experiencing frequent, stronger menstrual pain and you are taking pain med that is not going, you have to see your doctor immediately.
Doc, hold.
Because
Say
it may be due to something.
Doc, say that straight to the camera before we continue.
Yes. So because there are different type of menstrual pain, and there is this one that may be due to an anatomical problem there, is the reason why you do not have to keep using pain med all the time.
Okay.
If it is not going, you better see your doctor.
Great.
It may be due to something else.
Great.
And these are the possible things. Number one, it may be due to, so there are like a lot of them, but there are some two stubborn ones. One, chronic pelvic inflammatory disease.
Okay.
So it's not just the pelvic inflammatory disease, but women who keep having it intermittently, you know, and then sometimes they want to treat it on their own with a herbal medication. I mean, self-medicate, they don't really go to get investigated and treated well for them.
Okay.
Okay? So chronic pelvic inflammatory disease. You can be free to pick any of them and ask me a question about it. Because I'm going to give you the names, and then now if you want to ask anything about any of them, I'll go into it, then we flow. So chronic pelvic inflammatory disease, endometriosis. Okay, endometriosis. So if you use the anatomy of the uterus, remember I said it's always look like the face of a bull, okay,
with a horn.
and then it has the horn. So when you start from the edge to down, if you use the egg, we have ovarian tumor, ovarian cyst. It can cause secondary.
Doc, hold on.
Yes.
Viewers, if you really want to get that part of it, just go and watch Fertility. It's all there for you. So just go back and watch Fertility. That is well defined over there. Doc, back to you.
Actually, the normal uterus in the female body, the non-pregnant uterus, is a pear shape.
Okay.
It's just like a fist, like that. It's so small, like that. If there is no baby in it, that's like that, with the horns at the side. So when we take like the egg, I said the problem there that could cause a secondary dysmenorrhea or menstrual cramps is ovarian tumor or ovarian cyst. So that it comes up a lot. Most women do scan. Hey doc, we saw ovarian cyst. What do I do? Ovarian cyst. That could explain why they are having all the dysmenorrhea. But there are management for that. So ovarian cyst. When you come to the tube may be blocked as a result of an adhesion from a sexually transmitted infection that keep on and off. So, for example, gonorrhea, chlamydia especially, is the most notorious cause for some of this, tubal blockage. And then a woman who had a surgery before, any form of surgery in the abdomen, so cesarean section, hysterectomy, hysterectomy, you remove the whole tube. So, but any abdominal, don't worry, I'll talk about that. I don't want to swerve, the whole thing. So, any form of, intra-abdominal surgery can lead to adhesions of the organs. So not only the tube, but maybe the intestine or things of that sort. If only they handled that organ during the process, or even if there were fluid like blood and other things that came into contact in the healing process, it may end up adhering together. So the tube can be blocked from there. Okay. Now, when you come down, now you are coming to where? The uterus,
yes,
right?
The
uterus problems could be fibroid. So fibroid can be the reason why somebody will be having continuous dysmenorrhea.
Okay. So with the fibroid, it's there. So it only the pain only comes when they are having the flow.
Exactly.
So all these ones you're mentioning, the pain will only come when they are in the flow.
Yes.
Because there's something happening there at the moment.
At the moment. Okay. The normal architecture of the reproductive system has been changed. There is an organ there now. On this fibroid lies the endometrial lining. Within the fibroid is embedded within the muscle that is supposed to contract. You get it? It's supposed to contract and relax. And we said that the more it is contracted, the stronger the contraction, the more the pain. So it explains why if there's a fibroid sitting there, then that whole fibroid together with the normal muscle is also going to contract. So the pain will be more.
Okay.
You get it? So fibroid.
First, I wanted to ask a question, but
Go ahead.
let us divert a little. So the fibroid, it's in the middle lining.
In the middle lining, but it can be anywhere actually.
Okay.
But in the situation where it finds itself in the middle lining, it's more painful. It can be on the outer, it can be in the middle, and it can be in the inner. The inner one is where it will be competing with the baby. You know, so somebody will say they are becoming infertile because of the fibroid. Okay. It's more possible if it is inside, but if it's outside, you will have a normal pregnancy.
Doc, let's continue.
Okay, so the fibroid. Another thing, the uterus could be uterine polyps. So this one, they look like fibroid, but they are a bit different. They are also growths, you know, inside it. Another thing could be the adhesion again. Okay, adhesion again within the uterus, you know, like kind of sticking together. So there is a form of evacuation of uterus, like termination of pregnancies. It's a form of an abortion that some people, they will go and then the instrument will be used.
Yeah, those old time.
Yeah, they will dilate so they call it dilatation, DNC, dilatation and curettage. Okay, when they do that, if it's not done by, you know, a well-trained person, in fact, generally that whole procedure has the risk of causing scars in the uterine lining, and in the process, the healing, it will cause them to stick together and it will form the adhesions and stick together. So such a person, when they are having menses, it may be more painful than somebody with a more...
You put in metals and be scraping the womb.
Yeah. It used to be an old method
of abortion.
Yeah, even though some people still do it, even though we don't encourage that anymore in the area of comprehensive safe abortion care. It's not a thing we encourage anymore. We have a more better way of doing it.
That's just in the passing.
Yeah. So I think I took my time explaining the rest, but I didn't even talk more about the two most notorious people: pelvic inflammatory disease, endometriosis. Yeah. So in the uterus, sometimes the endometrial lining, the lining that is there, may find itself in the muscle side. Some part of it may find itself. You see, the layer is so unique that should one find itself in another place, it will be playing the role it used to play where it used to be in the foreign place.
How did he get there?
So, many ways. It could be through surgery. If there was a cesarean section during the closure and things, sometimes it can find itself in another place.
Okay.
It can also be from the embryological, process during the development stage. Okay. That cell may find itself in the wrong place and continue growing. If you find itself in the muscle, we call it adenomyosis. If you find itself any other place, so it can find itself on the ovary, on the ovary. This is the endometrial lining on the ovary. Can find itself in the tube. Can find itself in the cervix. Can find itself in the vagina. That is the endometriosis.
Okay.
Endometriosis. It is a stubborn. It's one of the most common cause of secondary dysmenorrhea. Yeah. Okay. So once every woman, it's you don't assume that your menstrual cramp is a normal one, especially if after taking all the pain medication, it's not going. It could be something else. Is that okay? Now, pelvic inflammatory disease. Pelvic inflammatory is simple as that. Pelvis. So anything that causes inflammation. I'm sure, and I have said it in other ways throughout all our discussion. Any form of infection. So PID is actually an ascending infection. It ascends. It always starts from somewhere down there. So all the sexually transmitted infections, gonorrhea, syphilis, chlamydia, sometimes it's able to ascend up and then start to go and infect the upper reproductive organ. So we have the lower reproductive and we have the upper one. The lower ones are the ones we are seeing outside, the ones we are eating, and
Yeah, eating.
I mean like. I forgot I was a reverend.
Anyway, that is the
so when it goes to the upper reproductive organ, that's where the uterus, the tubes, that is where it starts to affect it. So the same inflammatory process that happened with the dilatation and curettage, that's what also happened. It starts to cause inflammation in the endometrial lining, in the tubes, around the egg. And in the process, anytime there is a wound, there is healing. Yeah. So the healing,
a scar is formed.
It starts to form a scar. It clogs or kind of closes the tube. Okay. And this can result in ectopic one day. This can result in infertility later in life. This can result in many other complications. But one of the most important complications is a menstrual cramp in this case.
Okay.
So there are other things like we've said it from the egg. Now when you come down the cervix, there can be cervical stenosis. Okay. Some cervix may be narrowed or it can be blocked. So women are born with their cervix blocked. So it means that now where is the blood coming through? Mm-hmm. You get it. So if it's narrowed, it will be small blood that will come out. Mm-hmm. So it means that still there is something happening behind. It will be more painful than somebody with a more open cervix. Okay. You get it. So it's very easy to think about it. You start from the egg to it's so simple.
Yeah. Doc, I know time is also running against
all right.
us.
So today
a quick one.
Yeah.
I hear some ladies say, as for me, I'm so blessed. You don't see blood flowing out. I only menstruate in my palm. My palm and I met a lady like that actually. And when she's in she doesn't want you to touch her palm. She says it becomes painful and the pain is quite excruciating.
Yeah.
What is that? Is it normal? Is it good? How do you manage such situation?
First of all, if a woman is not seeing her menses and rather she's seeing something elsewhere, we need to investigate. There are several reasons why a woman may not be seeing their menses. Okay. It may be unrelated or it may be related.
Okay.
So it's very important. It may be a hormonal problem. As we said, these hormones are the ones that regulate the egg release, prepares the endometrial lining. If it doesn't occur, it will come out. So it means that there may be a problem with the messengers. In this case, the hormones. Those are the messengers. That tells that this one should be released. This one should be prepared for the implantation. Okay. Or there may be a problem with the organs that were told to release. So maybe the hormone gave the command, but the egg is having a problem. Okay. The moment where the egg becomes problematic, one suspect here is it's a condition we call polycystic ovarian syndrome, PCOS, PCOS. Okay? Maybe the reason why a woman may not be seeing her menses. But maybe I'm not seeing, maybe it may be unrelated to that. It may be an anatomical problem or it may be a hormonal problem. So maybe that.
It seems I've seen some words, somebody said cervical atria. Could that also be a cause that a woman may not be seeing her menses?
Exactly. So it is part of the cervical things I was talking about. Okay. So, but let's make it simple for them to appreciate. So the atresia may be after the child was born, after the whole embryology of the formation of the uterus. Some people may have the cervix closed. Sorry, that. I can see that you are reading. No, but the cervix, if this was supposed to be the body of the uterus, at the top, the cervix should be an opening before the vagina comes down. So if
cervix close, this means close. Different thing. At least close.
Oh, you guys,
it's okay. Don't just zoom into management. Time is fast spent.
Okay, all right. So, it is very simple, isn't it?
Yeah.
I mean,
just into
we have
the primary and the secondary.
Yes. So, we have pharmacological and non-pharmacological. But the other way is also correct. You can treat it according to secondary or primary. Let me use your way. Okay. Secondary or primary. The secondary, of course, you get any medication that can block the prostaglandin. Most of the pain medications, the primary. Most of the pain medications we have at the market are meant to block the prostaglandin. Normally, we call these medications NSAID, NSAID, non-steroidal anti-inflammatory drugs. Okay, non-steroidal anti-inflammatory drugs.
That name right now, I'm not ready to keep names. But you said all the pain. Are you talking about paracetamol too? Because
so I'll come there. So most of them. Okay, not all. Most of the pain medication we have at the market. Paracetamol is not an NSAID. Okay, but for some pain, paracetamol can help. So the first thing to do with the primary dysmenorrhea is to first assess the severity of your pain and grade it. That is why sometimes you can't do it home. You have to show up at the hospital for us to help you grade it. Okay, on a scale of 10. How would you grade it? Is it 1 over 10, 5 over 10, 9 over 10? Because whatever the grade or the severity determines the appropriate pain medication to be given to you.
So no self-medication?
No self-medication, as much as you can. All the time, talk to your doctor to determine whether this one, you need to go a little bit higher or not. There is a problem there. If you keep abusing these medications. So, you remember we made mention of prostaglandin, right?
Yes, I do.
Great. This prostaglandin is also responsible for the production of mucus, okay? Something like phlegms.
Michi. Like that.
Mucus that covers the stomach lining, especially areas with ulcer or with wound.
Okay.
And this allows the ulcer to heal under. It gives it time to heal. So remember, we are giving medication to kill prostaglandin down. But in killing it down, if you overuse it, it will start to affect the top. This same prostaglandin, which is causing you pain down there, is giving you a benefit of healing your ulcer up. So you can imagine what happens in a lady who abuses this pain medication.
Do you know what's coming to mind? So men too, do they have prostaglandin?
Oh, yes. Yes, exactly. We all have it. The pain, all the pain we feel when you are doing the lifting is prostaglandin, Kroya.
Oh, okay.
It's a prostaglandin, Kroya. It's so anytime you take pain medication, it goes to reduce it. However, if you abuse that pain medication, it will reduce the prostaglandin release in your stomach, which was responsible to help with healing of stomach ulcers.
Okay.
And so people with stomach ulcers, it's a contraindication. You don't give it to them, so that they can be given time to heal, or else the moment they take it, they will feel more pain.
Okay.
It explains it, right?
Yes.
Now, secondary means that you need to,
the primary is left with exercise. You need mention
no,
exercise.
I'll come there. So if you are using primary, secondary, it's different from pharmacological, non-pharmacological.
Okay.
Are you getting it now?
So you have zoomed to pharmacological.
Yes. So I'm using your primary, secondary, and I'll come to the pharmacological.
Doc, wait, there is something running through my mind. Let me ask first. So this prostaglandin that produces that mucus. Is it the same mucus that comes out when a woman is
No,
like
that's
during sexual intercourse?
Yeah, that's a different thing altogether. That one is it's a normal discharge which is secreted by the glands in the vagina and also around the cervix. We've had a whole section on
like that.
Yeah, it's also mucus, but remember we had a discussion on it, right?
When I say mucus, I'm just imagining Michipa coming out from that.
Yeah, but I remember that in our last discussion on vaginal discharge, we discussed
exactly
the difference in the various discharges depending on the particular point in time of the life of the woman. So because you see the cycle. Do you want me to go back?
No.
Or we should refer our viewers to watch our vaginal discharge.
Exactly.
Okay, so they should do that. But there's a point in time it will be thin. There's a time it will be thick. So it's not all the time that is having the mucus thing.
Okay.
During sexual intercourse, it will be cloudy. It's depending on the time. Okay, so secondary depends on the cause. Okay, so every cause and what is done. If it's a PID, pelvic inflammatory disease, we give an antibiotic and it gets
Doc,
better.
I don't want you to go that way. They should come to the hospital.
They should come to the hospital. So everyone and the cause. If it's fibroid, depends. So everyone and the cause. Now, if you want to look at it from the level of pharmacological and non-pharmacological, the non-pharmacological includes lifestyle. The lifestyle, obviously, if we said obese, or gaining weight increases your risk.
Weight.
So you work on your exercise. Okay, aerobic exercise is something that we need to. I've told you the people that I'm always jealous of.
Yes, the young people.
Young people who exercise,
don't drink.
People who don't drink, people who don't smoke.
Yes.
Was a fit one,
I forgot.
It will come. Yes, it will come. But it's an important thing. If you as young as this age, we need to invest a lot more in staying physically active.
Exactly.
So that helps also in reducing the severity in the upcoming menses. The next one, women who are physically active, research has shown that they have lesser pain. During the time of the pain, one thing they can do is yoga exercise. So this is like kind of meditation, breathing control exercise that helps, kind of divert your attention from the pain, and it helps somehow to relieve you of the pain. We can also apply warm complex. So you find some warm water
bottle.
Bottle, and then you put it there. Remember, you see the way when you are feeling cold, what do? You kind of wrap yourself together. You constrict your body. That's what happens in the times of the pain. The vessels constrict together. Themselves. So should you apply heat to it,
they loosen up,
they will open up, and the pain comes down. So that's what happened. Together with the muscle contraction, the strength will not be too forceful anymore.
It's true. When you even bath warm water, the muscles relax.
It relaxes. When you are cold, when you are hot like this, doom saw and all the thing, that's the day you will open up. You will sleep sometimes naked in the room and all. So yeah, warm complex does a lot good in times of menstrual cramps. What else? So pharmacological is obvious. Pain medication, and in some instances we give hormones. The contraceptives can be given in some instances.
But that one is restricted to the medical practitioner.
Exactly. So
to tell you that you need that.
I mean, all this we are talking about is tell you that this is what happens if you report to the hospital. We are able to now find out whether it is a primary or a secondary. And if it's secondary, what type is it? And we'll give you what to do. But in the house, if there is something you can do to start, exercise, warm complex, the diversional therapy,
the
yoga. These are things you can do. And even your food, as we've made mention of, if you can avoid, caffeine, sugary food, yes, it helps.
Oh, okay. That's great. Anyway, it was nice.
Interesting.
Yeah.
So, Doc, what do you have to tell the women out there? Because menstrual cramps is not anything that people have. They feel like it's normal, so they don't want to go to the hospital. It's just a matter of 4 or 5 days.
I mean, if it's able to go down after taking your pain medication, there is no need to come to the hospital. At least you now understand that it was a natural thing that was happening. But it is only problematic if it is affecting your social life. It's like we said, if it's too painful that it's affecting your behavior, it's affecting your attention. You are talking to someone, but you are enduring too much pain that you are not able to give your full attention to it. Then you have to report to the hospital.
Okay. Thank you so much. So viewers, you have heard it all. Menstrual cramps, what it means. We have the types. You know when to see your doctor. When you bleed more than normal, you see your doctor. When the pain doesn't go, when you take your pain medications, see your doctor, because there might be a lot more to it. Thank you. We'll be back next time with another interesting topic. See ya. Bye.